Hello guys, welcome to my channel Twastramanas.
In this video we are going to see the other 6 types of counseling. 7. Mental health. 8. Child and adolescent counseling. 9. Grief counseling. 10. Trauma counseling. 11. School counseling and 12. Crisis counseling. Introduction. Mental health counseling is a vital aspect of providing support and assistance to individuals facing psychological challenges. It involves a structured process that aims to help clients understand their feelings, behaviors, and thoughts while empowering them to make positive changes in their lives. Throughout this guide, we'll explore the stages, models, and tools utilized in mental health counseling, along with practical examples to illustrate their application. Stages of counseling. 1. Establishing rapport. The initial stage of counseling focuses on building a trusting relationship between the counselor and the client. This sets the foundation for effective communication and collaboration throughout the counseling process. For instance, a counselor may engage in active listening and empathetic responses to create a safe space for the client to express themselves freely. Consider a scenario where a counselor, Sarah, meets with a new client, Alex, who is struggling with anxiety. Sarah begins the session by warmly greeting Alex, offering a comfortable space, and actively listening to his concerns. Through her empathetic responses and genuine interest, Sarah builds rapport, establishing trust and creating a supportive environment for Alex to open up about his experiences. 2. Assessment and goal setting. During this stage, the counselor conducts a comprehensive assessment to gather information about the client's background, presenting issues, and goals for counseling. This may involve using standardized assessment tools, conducting interviews, and exploring the client's strengths and resources. For example, a counselor working with a client experiencing depression may use the Beck Depression Inventory to assess the severity of symptoms and collaboratively set goals for treatment. 3. Exploration and insight. In this stage, the counselor and client work together to explore underlying thoughts, emotions, and patterns of behavior contributing to the client's difficulties. The counselor may utilize various therapeutic techniques such as cognitive restructuring, mindfulness exercises, or narrative therapy to facilitate insight and self-awareness. For instance, a counselor assisting a client with anxiety may use cognitive behavioral techniques to challenge irrational beliefs and teach relaxation strategies to manage symptoms. 4. Action planning and implementation. Once insights are gained, the focus shifts towards developing practical strategies and action plans to address the client's concerns. This may involve setting small, achievable goals, practicing new coping skills, and monitoring progress over time. For example, a counselor working with a client struggling with social anxiety may help them gradually confront feared situations through exposure therapy while providing support and encouragement. 5. Review and termination. The final stage of counseling involves reviewing progress, celebrating achievements, and preparing for termination or transition. The counselor and client reflect on the changes made, identify areas of continued growth, and discuss strategies for maintaining progress post-counseling. For instance, a counselor may help a client develop relapse prevention strategies and provide referrals to ongoing support services as needed. Models of counseling. 1. Psychodynamic therapy. This model emphasizes the role of unconscious conflicts and early life experiences in shaping current behavior and relationships. Through techniques such as free association, dream analysis, and interpretation, clients gain insight into underlying dynamics and patterns. For example, a psychodynamic therapist may help a client explore how childhood experiences influence their current relationship patterns and self-concept. 2. Cognitive behavioral therapy, CBT. CBT focuses on identifying and challenging maladaptive thoughts and behaviors that contribute to psychological distress. Clients learn practical skills to change negative thought patterns, modify behaviors, and develop more adaptive coping strategies. For instance, a CBT therapist may teach a client with panic disorder relaxation techniques and cognitive restructuring to reduce anxiety symptoms. 3. Humanistic existential therapy. This model emphasizes the importance of self-awareness, personal growth, and authenticity in living a fulfilling life. Therapists create a supportive and non-judgmental environment where clients can explore their values, beliefs, and existential concerns. For example, A humanistic existential therapist may help a client struggling with existential anxiety find meaning and purpose in their experiences through exploration of values and existential themes. Tools of counseling. 1. Genograms. A genogram is a visual representation of a client's family history, illustrating relationships, patterns, and dynamics across generations. It can help clients gain insight into intergenerational influences on their current functioning and relationships. For instance, a counselor may use a genogram to explore how family communication patterns contribute to a client's difficulty expressing emotions. 2. Socratic questioning. Socratic questioning involves asking thought-provoking questions to encourage critical thinking and self-reflection. It helps clients examine their assumptions, beliefs, and perspectives more deeply. For example, a counselor may use Socratic questioning to help a client explore the consequences of their actions and consider alternative viewpoints. 3. Behavioral experiments. Behavioral experiments involve testing out new behaviors or beliefs in real-life situations to gather evidence and challenge existing assumptions. They help clients overcome fear and avoidance by providing opportunities for experiential learning. For instance, a counselor may conduct a behavioral experiment with a client with social anxiety by encouraging them to engage in social interactions and observe their reactions and outcomes. Mental health counseling is a collaborative process that empowers individuals to overcome challenges, enhance self-awareness, and achieve personal growth. By integrating various stages, models, and tools of counseling, counselors can tailor their approach to meet the unique needs of each client. Through compassionate support, evidence-based interventions, and ongoing collaboration, mental health counselors play a crucial role in promoting well-being and resilience in individuals and communities. Child and Adolescent Counseling, a comprehensive guide. Child and adolescent counseling is a specialized field of therapy focused on assisting young individuals in managing and overcoming emotional, psychological, and behavioral difficulties. This form of counseling aims to provide children and adolescents with the tools and strategies they need to navigate various challenges, fostering their overall mental health and well-being. The process involves several stages, models, and tools tailored to the unique developmental needs of young clients. Stages of child and adolescent counseling. 1. Assessment and engagement. Initial assessment. The first stage involves gathering comprehensive information about the child's history, current functioning, and presenting problems. This includes interviews with the child, parents, and sometimes teachers. Building rapport. Establishing trust and rapport with the child is crucial. This involves creating a safe, non-judgmental environment where the child feels comfortable sharing their thoughts and feelings. 2. Goal setting. Collaborative goal setting. The counselor works with the child and their family to set specific, measurable, achievable, relevant, and time-bound, SMART goals. These goals guide the counseling process and provide a benchmark for progress. 3. Intervention and therapy. Implementation of interventions. Based on the assessment, the counselor selects appropriate interventions and therapeutic techniques tailored to the child's needs. Regular sessions. Therapy sessions are conducted regularly, during which various therapeutic activities and discussions take place. 4. Monitoring and evaluation. Ongoing assessment. The counselor continuously monitors the child's progress, adjusting interventions as necessary. Feedback. Regular feedback sessions with the child and their parents ensure that everyone is aligned and any concerns are promptly addressed. 5. Closure and follow-up. Termination. Once the counseling goals are achieved, the process of ending therapy is carefully managed to ensure the child is prepared to move forward independently. Follow-up. Periodic follow-up sessions may be scheduled to ensure the child maintains progress and to address any new issues that arise. Models of child and adolescent counseling. 1. Cognitive Behavioral Therapy, CBT, concept. CBT focuses on identifying and changing negative thought patterns and behaviors. It helps children and adolescents develop coping strategies to deal with various challenges. Example: a 14-year-old struggling with anxiety might work with a counselor to identify irrational fears and develop healthier thinking patterns through cognitive restructuring. 2. Play therapy. Concept. Play therapy uses play as a medium for children to express their feelings and experiences. It is particularly effective for younger children who may struggle to articulate their emotions verbally. Example, a 6-year-old child who has experienced trauma might use dolls and action figures to reenact events, helping the counselor understand their emotional state and guiding them towards healing. 3. Family therapy. Concept. Family therapy involves working with the entire family system to address issues that affect the child. It emphasizes improving communication, resolving conflicts, and strengthening family bonds. Example, a family experiencing conflict due to a child's behavioral issues might engage in family therapy sessions to improve understanding and cooperation among family members. 4. Attachment-based therapy. Concept. This model focuses on strengthening the child's attachment to their primary caregivers. It is based on the idea that a secure attachment forms the foundation for healthy emotional development. Example, a child with attachment issues due to early separation from parents might work with a counselor to build trust and secure attachment with their current caregivers. 5. Solution-focused brief therapy, SFBT, concept. SFBT is a short-term approach that focuses on solutions rather than problems. It helps children and adolescents identify and utilize their strengths to achieve specific goals. Example, a teenager struggling with low self-esteem might work with a counselor to identify past successes and strengths, using them to build a more positive self-image. Tools and techniques in child and adolescent counseling. 1. Art therapy. Tool. Art therapy uses creative processes such as drawing, painting, and sculpting to help children express their emotions and experiences. Example, a child who has difficulty talking about their feelings might use drawing to illustrate their emotional state, providing the counselor with insights into their internal world. 2. Behavioral charts and contracts. Tool. These tools are used to encourage positive behaviors and discourage negative ones. Behavioral charts track progress, while contracts outline specific expectations and rewards. Example, a child with ADHD might use a behavioral chart to monitor their progress in completing homework, with rewards for achieving specific targets. 3. Social stories. Tool. Social stories are short narratives that describe social situations and appropriate responses. They are particularly useful for children with autism spectrum disorders. Example, a social story might be created to help a child understand how to make friends at school, detailing steps like greeting others, sharing, and taking turns. 4. Mindfulness and relaxation techniques. Tool. Mindfulness exercises and relaxation techniques help children manage stress and anxiety. These practices can include deep breathing, guided imagery, and progressive muscle relaxation. Example, an adolescent dealing with exam stress might learn mindfulness meditation to stay calm and focused during study sessions and tests. 5. Role-playing. Tool. Role-playing allows children to practice social skills and problem-solving in a safe environment. It helps them develop confidence and prepare for real-life situations. Example, a shy child might engage in role-playing scenarios where they practice initiating conversations with peers, building their social confidence. Case Study 1. Managing Anxiety in Adolescence. Background. Ekta, a 15-year-old girl, has been experiencing severe anxiety, particularly related to school performance and social interactions. Her parents report that she often has panic attacks and avoids social situations. Intervention. Ekta's counselor uses CBT to help her identify and challenge her irrational fears. Through cognitive restructuring, Ekta learns to replace negative thoughts with more balanced ones. Additionally, she practices relaxation techniques to manage her anxiety symptoms. Outcome. Over several months, Ekta's anxiety levels decrease significantly. She becomes more confident in social settings and performs better academically. Case Study 2. Addressing Behavioral Issues in Early Childhood. Background. Raj, a 7-year-old boy, exhibits aggressive behavior both at home and school. His teachers report frequent outbursts and difficulty following instructions. His parents are concerned about his ability to form positive relationships with peers. Intervention. The counselor uses play therapy to help Raj express his frustrations and identify underlying issues. Behavioral charts and positive reinforcement are also implemented to encourage better behavior. Additionally, family therapy sessions help address any dynamics at home contributing to Raj's behavior. Outcome. Over time, Raj's behavior improves. He becomes better at managing his emotions and following instructions. His relationships with peers and family members also show marked improvement. Case study 3. Supporting a child with autism. Background. Neil, an 8-year-old boy with autism, struggles with social interactions and communication. He often feels overwhelmed in social settings and has difficulty understanding social cues. Intervention. The counselor uses social stories to help Neil understand and navigate social situations. Role-playing exercises allow him to practice social skills in a controlled environment. Additionally, Neil's parents receive guidance on how to support his social development at home. Outcome. Neil shows significant progress in his social skills. He becomes more comfortable in social settings and better understands how to interact with others. His parents report improved communication and fewer meltdowns. Conclusion. Child and adolescent counseling is a dynamic and multifaceted field that requires a deep understanding of developmental psychology, therapeutic techniques, and the unique challenges faced by young individuals. By utilizing various models, stages, and tools, counselors can effectively support children and adolescents in overcoming their difficulties and achieving their full potential. Whether through cognitive behavioral techniques, play therapy, or family interventions, the ultimate goal is to empower young clients to lead healthier, happier lives. Understanding grief counseling. Grief counseling is a form of therapy designed to help individuals cope with the emotional, physical, and psychological effects of losing a loved one. The process of grieving can be overwhelming, and without proper support, it can lead to prolonged distress and other mental health issues. Grief counseling provides a structured environment where individuals can express their emotions, process their loss, and find ways to move forward. This comprehensive guide will explore the stages of grief, various models and tools of counseling, and provide detailed examples to illustrate how these concepts are applied in practice. The stages of grief. The stages of grief were first introduced by Elizabeth Kubler-Ross in her 1969 book, On Death and Dying. These stages provide a framework for understanding the grieving process. It is important to note that not everyone experiences all stages, nor do they occur in a linear fashion. The 5 stages are 1. Denial. This initial stage involves shock and disbelief. The individual might think, this can't be happening to me. Example. After losing a spouse, a person might continue to set a place at the dinner table for them, unable to accept their absence. 2. Anger. As the reality of the loss sets in, anger may surface. The individual might feel frustrated and helpless, directing their anger at themselves, others, or the deceased. Example. A bereaved parent might feel intense anger towards medical staff, believing they didn't do enough to save their child. 3. Bargaining. During this stage, individuals often make bargains with a higher power, hoping to reverse or delay the loss. They might dwell on, what if, or, if only, statements. Example. Someone might pray for a deceased loved one to come back, promising to live a better life in exchange. 4. Depression. Profound sadness and despair characterize this stage. The individual might withdraw from life, feeling that it is no longer worth living. Example. After losing a job due to illness, a person might lose interest in activities they once enjoyed, feeling hopeless about the future. 5. Acceptance. This final stage involves coming to terms with the loss. The individual begins to find a way to move forward, though the pain may still be present. Example. A widow might start to participate in social activities again, finding joy in life while still cherishing memories of their spouse. Models of grief counseling. Several models have been developed to understand and facilitate the grieving process. Here, we will explore 3 prominent models: Warden's task model, the dual process model, and the meaning reconstruction model. Warden's task model. J. William Warden proposed 4 tasks of mourning that individuals need to work through to resolve their grief. 1. Accept the reality of the loss. This task involves recognizing and accepting that the loss has occurred. Example. A woman who has lost her father might visit his grave regularly to reinforce the reality of his passing. 2. Process the pain of grief. Allowing oneself to experience and express the pain associated with the loss is crucial. Example. A man might join a grief support group where he can openly share his feelings and memories of his deceased friend. 3. Adjust to a world without the deceased. This task requires adapting to the changes in one's environment and roles. Example. A mother who has lost her husband might learn to handle financial matters and household chores that her husband previously managed. 4. Find an enduring connection with the deceased while moving forward. Maintaining a connection to the deceased while continuing with life is important. Example: a daughter might keep a photo album of her mother and regularly share stories about her with her children, while still engaging in new activities and relationships. Dual process model. Developed by Margaret Strober and Henk Shah, the dual process model emphasizes oscillation between two types of stressor: loss-oriented and restoration-oriented. 1. Loss-oriented stressor. These involve dealing with the emotional aspects of the loss, such as sadness, yearning, and reminiscing. Example: a man might spend time looking at old photographs and crying, allowing himself to feel the pain of his wife's death. 2. Restoration-oriented stressor. These involve coping with the practical changes and new challenges that arise as a result of the loss. Example: a widow might take up new hobbies or re-enter the workforce to fill the void left by her husband's death. Oscillation between these stressors is a natural part of the grieving process, allowing the individual to manage grief while also adapting to life changes. Meaning reconstruction model. Robert Niemeyer's meaning reconstruction model focuses on the need for individuals to reconstruct a sense of meaning in their lives after a loss. This model emphasizes narrative and the personal significance of the loss. 1. Sense-making. Individuals attempt to understand and make sense of the loss. Example: a bereaved person might seek therapy to explore the impact of their loved one's death on their beliefs and values. 2. Benefit finding. Identifying any positive aspects or growth resulting from the loss. Example: after losing a sibling to cancer, an individual might become an advocate for cancer research and find a sense of purpose in their advocacy work. 3. Identity reconstruction. Redefining oneself and one's life in the aftermath of the loss. Example: a person who has lost their partner might engage in new activities in social circles, gradually building a new sense of identity and self-worth. Tools and techniques in grief counseling. Grief counselors employ various tools and techniques to support individuals through their grieving process. These include cognitive behavioral therapy, CBT, narrative therapy, art therapy, and group therapy. Cognitive behavioral therapy, CBT. CBT helps individuals challenge and change unhelpful thoughts and behaviors associated with their grief. Techniques include cognitive restructuring, identifying and reframing negative thoughts. Example: a grieving person who feels guilty about their loved one's death might work with a therapist to challenge and reframe these thoughts, understanding that they are not responsible for the loss. Behavioral activation, encouraging engagement in meaningful activities. Example: a therapist might encourage a bereaved client to resume hobbies they once enjoyed or to volunteer, helping them reconnect with life and find new sources of joy. Narrative therapy. Narrative therapy involves exploring and reshaping the stories individuals tell about their loss. Techniques include externalization, separating the grief from the person's identity. Example: a therapist might help a client see grief as something they are experiencing, rather than as a defining part of themselves, allowing them to regain a sense of control. Reauthoring, creating new, empowering narratives. Example: a person might work with a therapist to rewrite their story, focusing on their resilience and the positive memories of their loved one, rather than solely on the pain of the loss. Art therapy. Art therapy allows individuals to express their grief creatively, which can be especially helpful for those who struggle to articulate their feelings verbally. Techniques include drawing and painting, using art to explore and express emotions. Example: a bereaved child might draw pictures of their deceased parent, using the artwork to convey feelings they find difficult to verbalize. Collage and sculpture, creating tangible representations of grief and memory. Example: a grieving person might create a collage of photographs, letters, and other mementos to honor and remember their loved one. Group therapy. Group therapy provides a supportive environment where individuals can share their experiences and learn from others who are also grieving. Benefits include peer support, sharing experiences with others who understand. Example: a support group for widows and widowers provides a space for members to discuss their feelings and offer mutual support and encouragement. Shared learning, gaining insights and coping strategies from group members. Example: In a group setting, a bereaved person might learn new ways of coping with holidays and anniversaries from others who have faced similar challenges. Conclusion. Grief counseling is a vital process that helps individuals navigate the complex emotions and changes that accompany the loss of a loved one. By understanding the stages of grief, utilizing various models and tools, and applying practical examples, grief counselors can provide effective support and facilitate healing. Through compassionate guidance and evidence-based techniques, individuals can find a path to recovery and learn to live with their loss in a meaningful way. Trauma counseling, comprehensive overview. Trauma counseling is a specialized area of mental health counseling focused on helping individuals recover from traumatic experiences. These experiences can range from single incidents, such as accidents or assaults, to prolonged exposure to stress, such as ongoing abuse or living in a war zone. Trauma counseling involves several stages, models, and tools designed to support the healing process. This comprehensive overview will delve into each aspect, providing detailed explanations and relevant examples. Stages of trauma counseling. 1. Establishing safety. Description. The primary focus is to create a sense of safety for the client. This includes physical safety, emotional stability, and establishing a trusting relationship between the client and counselor. Example. A counselor working with a survivor of domestic abuse might spend several sessions ensuring the client feels secure enough to discuss their experiences. This could involve working with local shelters to ensure the client is in a safe environment. 2. Remembrance and mourning. Description. This stage involves revisiting and processing the traumatic memories in a controlled and supportive environment. The client begins to confront and express feelings associated with the trauma. Example. A veteran with PTSD might use narrative therapy to recount their experiences during combat, with the counselor guiding them through the process and helping them manage intense emotions. 3. Reconnection and integration. Description. The final stage focuses on integrating the trauma into the client's life narrative and moving forward. It involves rebuilding a sense of self, relationships, and a new future. Example. A sexual assault survivor might work on developing new relationships and rebuilding trust in others, with the counselor facilitating activities and discussions that foster a positive outlook on life. Models of trauma counseling. 1. Cognitive behavioral therapy, CBT. Description. CBT focuses on identifying and changing negative thought patterns and behaviors. It is effective for trauma because it helps clients reframe their thoughts about the traumatic event and develop coping strategies. Example. A person who survived a car accident might have developed a fear of driving. Through CBT, they could challenge the belief that driving is inherently dangerous and practice exposure therapy to gradually become comfortable driving again. 2. Eye movement desensitization and reprocessing, EMDR. Description. EMDR involves the client recalling traumatic memories while the counselor guides them through bilateral stimulation, such as eye movements or tapping. This process helps reprocess the trauma and reduce its emotional impact. Example. A rape survivor might undergo EMDR sessions where they recall specific traumatic memories while following the counselor's hand movements, leading to a reduction in PTSD symptoms over time. 3. Psychodynamic therapy. Description. This model explores the unconscious processes and how past experiences shape current behavior and emotions. It aims to uncover unresolved conflicts from the trauma. Example. A client experiencing recurring nightmares after a traumatic event might explore their dreams in psychodynamic therapy to uncover underlying fears and anxieties, leading to a deeper understanding and resolution. 4. Somatic experiencing. Description. This model focuses on the body's responses to trauma and aims to release the physical tension stored in the body. It emphasizes awareness of bodily sensations to process trauma. Example. A person who experienced childhood abuse might work with a counselor to become aware of and release chronic muscle tension through body-focused techniques like breathing exercises and mindful movement. Case study. A comprehensive example. Background. Sarah, a 32-year-old woman, was involved in a severe car accident a year ago. Since the accident, she has developed severe anxiety, nightmares, and a fear of driving. She sought trauma counseling to address these issues. Stage 1. Establishing safety. Initial sessions. The counselor focuses on building trust and ensuring Sarah feels safe in the therapeutic environment. They discuss Sarah's current life situation and ensure she has a stable support system. Grounding techniques. Sarah learns grounding techniques to manage anxiety and panic attacks, such as deep breathing exercises and focusing on sensory experiences. Stage 2. Remembrance and mourning. Narrative therapy. Sarah begins to recount the details of the accident in a safe and controlled manner. The counselor helps her process the emotions associated with these memories. EMDR sessions. Sarah participates in EMDR, recalling specific traumatic moments from the accident while following the counselor's finger movements. Over several sessions, she experiences a reduction in the intensity of her emotional responses. Stage 3. Reconnection and integration. Cognitive restructuring. Using CBT, Sarah works on challenging and reframing her negative thoughts about driving and her overall sense of safety. Exposure therapy. Sarah gradually begins to face her fear of driving. Initially, she practices sitting in a stationary car, then progresses to short drives with the counselor's support. Future planning. Sarah and the counselor discuss her goals and aspirations, focusing on rebuilding her confidence and envisioning a future where the trauma does not control her life. Outcome. Over the course of a year, Sarah makes significant progress. She no longer experiences severe anxiety or nightmares, and she has regained confidence in her ability to drive. The trauma is integrated into her life story as a challenging experience she overcame, rather than a defining moment that controls her present and future. Conclusion. Trauma counseling is a multifaceted and deeply personal process that requires tailored approaches to meet each individual's unique needs. By understanding and applying various stages, models, and tools of trauma counseling, mental health professionals can effectively guide clients through their healing journeys. This comprehensive approach ensures that clients like Sarah can move from a place of fear and pain to one of strength and resilience, ultimately leading to a healthier and more fulfilling life. School counseling, stages, models, and tools. School counseling is a vital component of the educational system, providing essential support to students in their academic, personal, social, and career development. Effective school counseling involves understanding and implementing various stages, models, and tools to address the diverse needs of students. This comprehensive guide explores these elements in detail, providing relevant examples to illustrate their application. Stages of school counseling. 1. Initial assessment. The initial assessment stage involves gathering information about the student's background, current issues, and overall well-being. This can be done through interviews, questionnaires, and observations. Example: a school counselor might meet with a student who is struggling academically and has recently shown signs of social withdrawal. During the initial assessment, the counselor gathers information from the student, teachers, and parents to understand the root cause of the problem. 2. Goal setting. After the initial assessment, the counselor and the student set specific, measurable, achievable, relevant, and time-bound, SMART goals. These goals guide the counseling process and provide a clear direction for the interventions. Example: a student experiencing anxiety about upcoming exams might set a goal to learn and practice 3 relaxation techniques within the next month to help manage stress. 3. Intervention planning. In this stage, the counselor develops a tailored intervention plan based on the student's unique needs and goals. This plan may include individual counseling sessions, group therapy, or referrals to external resources. Example: a student dealing with bullying might have a plan that includes weekly individual counseling sessions to build self-esteem, a peer support group, and collaboration with teachers to address the bullying behavior. 4. Implementation. The implementation stage involves putting the intervention plan into action. The counselor works closely with the student, providing support and guidance throughout the process. Example: for a student struggling with time management, the counselor might conduct weekly sessions to teach organizational skills, monitor the student's progress, and adjust strategies as needed. 5. Evaluation and review. The final stage involves evaluating the effectiveness of the interventions and reviewing the student's progress towards their goals. Adjustments to the intervention plan may be made based on this evaluation. Example: a counselor reviews the progress of a student who set goals to improve social skills. They assess whether the student has become more engaged in group activities and less isolated, making any necessary adjustments to the intervention plan. Models of school counseling. 1. The Comprehensive Developmental School Counseling Model. This model emphasizes the developmental needs of students and integrates academic, career, and personal, social development into the counseling program. It is proactive and preventative, designed to promote student success. Example: a school implements a comprehensive counseling program that includes classroom lessons on study skills, career exploration workshops, and peer mediation programs to address conflicts. 2. Solution-Focused Brief Counseling, SFBC. SFBC is a short-term, goal-oriented approach that focuses on solutions rather than problems. It helps students identify their strengths and resources to overcome challenges. Example: a counselor working with a student who has low motivation in school uses SFBC techniques to help the student identify past successes, set achievable goals, and develop a plan to increase motivation. 3. Cognitive Behavioral Therapy, CBT. CBT is a widely used model in school counseling that addresses negative thought patterns and behaviors. It helps students develop coping skills and strategies to manage their emotions and behaviors. Example: a student with test anxiety might work with a counselor using CBT to identify and challenge negative thoughts about their abilities, learn relaxation techniques, and practice positive self-talk. 4. Person-centered counseling. This model, developed by Carl Rogers, focuses on creating a supportive and non-judgmental environment where students feel valued and understood. It emphasizes the importance of empathy, unconditional positive regard, and congruence. Example: a counselor uses a person-centered approach to help a student experiencing family issues. The counselor provides a safe space for the student to express their feelings and works collaboratively to explore solutions. Tools of school counseling. 1. Assessment tools. Assessment tools help counselors gather information about students' academic performance, emotional well-being, and social skills. These tools can include standardized tests, surveys, and behavioral checklists. Example: a school counselor uses the Beck Depression Inventory, BDI, to assess the severity of depressive symptoms in a student who has been showing signs of depression. 2. Counseling techniques. Counseling techniques are specific methods used during sessions to facilitate communication and support students. Techniques can include active listening, open-ended questions, and role-playing. Example: during a session with a student struggling with peer relationships, the counselor uses role-playing to help the student practice assertive communication skills. 3. Technology and digital tools. Technology can enhance the counseling process by providing resources and tools for both counselors and students. These can include online assessment tools, virtual counseling sessions, and educational apps. Example: a school counselor uses an app like Calm to teach students mindfulness and relaxation techniques that they can practice at home. 4. Referral systems. Referral systems are essential for connecting students with additional resources and support outside the school. This can include mental health services, community programs, and specialist providers. Example: a student with severe anxiety might be referred to an external mental health professional for specialized treatment, while the school counselor continues to provide ongoing support and coordination. 5. Group counseling. Group counseling allows students to share experiences and support each other under the guidance of a counselor. It can address common issues such as social skills, grief, and stress management. Example: a school counselor facilitates a group for students who have experienced loss. In the group, students share their experiences, learn coping strategies, and support one another in their grief journey. Conclusion: school counseling is a multifaceted process that requires a comprehensive understanding of the stages, models, and tools involved. By effectively assessing students, setting goals, planning and implementing interventions, and evaluating progress, school counselors can provide crucial support that enhances students' academic and personal development. Using various models such as the Comprehensive Developmental School Counseling Model, Solution-Focused Brief Counseling, Cognitive Behavioral Therapy, and Person-Centered Counseling, counselors can address a wide range of student needs. Additionally, the use of assessment tools, counseling techniques, technology, referral systems, and group counseling can further enhance the effectiveness of school counseling programs. Through these efforts, school counselors play a pivotal role in fostering a supportive and thriving school environment. Crisis counseling, stages, models, and tools. Crisis counseling is a specialized field aimed at helping individuals who are experiencing an acute psychological crisis. The goal is to provide immediate, short-term assistance to help individuals regain their equilibrium and cope with the crisis. This type of counseling involves several stages, models, and tools designed to support individuals effectively. Stages of crisis counseling. 1. Assessment. The first stage involves evaluating the individual's situation to understand the nature and severity of the crisis. This includes assessing the individual's mental state, risk factors, and immediate needs. Example: a counselor meets with a client who has just experienced a traumatic event, such as the sudden death of a loved one. The counselor asks questions to understand the client's emotional state, their support system, and any immediate threats to their safety, such as suicidal thoughts. 2. Establishing rapport. Building a trusting relationship is crucial for effective counseling. The counselor must create a safe, non-judgmental environment where the individual feels heard and supported. Example: during the first session, the counselor listens empathetically, validates the client's feelings, and assures them that it is okay to express their emotions. This helps the client feel understood and begins to build trust. 3. Identifying the major problems. Pinpointing the specific issues that are contributing to the crisis is essential. This helps in focusing the counseling sessions and creating a targeted intervention plan. Example: the client is overwhelmed by multiple stressors, including job loss, relationship issues, and health concerns. The counselor helps the client prioritize these issues and identify the most pressing problem that needs immediate attention. 4. Dealing with emotions. The individual must be allowed to express their emotions in a safe space. The counselor helps the client understand and process these emotions, which is a critical step towards healing. Example: the client expresses feelings of anger and sadness related to their loss. The counselor encourages the client to talk about their emotions and provides techniques for managing intense feelings, such as deep breathing exercises or journaling. 5. Exploring alternatives. The counselor works with the client to identify potential solutions and coping strategies. This stage involves brainstorming and evaluating different options to address the crisis. Example: the counselor and client discuss possible steps to improve the client's situation, such as seeking financial assistance, reaching out to supportive friends or family members, and engaging in self-care activities. 6. Formulating an action plan. Developing a concrete plan of action helps the client feel more in control and focused. The plan should include specific, achievable steps that the client can take to address their crisis. Example: the action plan might include scheduling an appointment with a financial advisor, joining a support group, and setting small daily goals to enhance the client's sense of accomplishment. 7. Follow-up. Ensuring that the client continues to receive support is important for long-term recovery. Follow-up sessions help the counselor monitor progress and make any necessary adjustments to the intervention plan. Example: the counselor schedules a follow-up session for the following week to check on the client's progress, offer additional support, and adjust the action plan as needed. Models of crisis counseling. 1. Roberts' 7-stage crisis intervention model. This model is widely used and encompasses the stages mentioned above, emphasizing a structured approach to crisis intervention. 2. ABC model of crisis intervention. This model focuses on 3 main components. A. Achieving contact with the person in crisis. B. Boiling down the problem to its essentials. C. Coping strategies are developed to help the person manage their crisis. 3. Gilliland's 6-step model. This model outlines 6 steps, defining the problem, ensuring client safety, providing support, examining alternatives, making plans, obtaining commitment. Tools used in crisis counseling. 1. Active listening. This tool involves fully concentrating, understanding, responding, and remembering what the client is saying. It helps build rapport and trust. Example: the counselor uses active listening techniques such as nodding, maintaining eye contact, and summarizing what the client says to ensure they feel heard. 2. Empathy and validation. Expressing empathy and validating the client's feelings are crucial in making them feel understood and supported. Example: the counselor says, "I can see how the situation is incredibly painful for you. It's understandable that you're feeling overwhelmed." 3. Safety planning. This tool is used to ensure the client's immediate safety, especially if there are risks of self-harm or harm to others. Example: the counselor works with the client to create a safety plan that includes removing dangerous objects from their environment, identifying safe places, and having emergency contacts readily available. 4. Cognitive behavioral techniques. These techniques help clients identify and challenge negative thought patterns and develop healthier ways of thinking. Example: the counselor helps the client identify irrational thoughts contributing to their anxiety and teaches them how to reframe these thoughts more positively. 5. Grounding techniques. These techniques help clients stay present and reduce anxiety during a crisis. Example: the counselor guides the client through a grounding exercise, such as the 5, 4, 3, 2, 1 technique, which involves identifying 5 things they can see, 4 things they can touch, 3 things they can hear, 2 things they can smell, and 1 thing they can taste. Detailed example of crisis counseling in action. Jana, a 30-year-old woman, experiences a severe panic attack after losing her job unexpectedly. She feels hopeless, unable to cope, and is considering self-harm. 1. Assessment. The counselor meets with Jana and assesses her mental state, including the intensity of her panic, her thoughts of self-harm, and her immediate needs for support. 2. Establishing rapport. The counselor creates a safe space for Jana to express her feelings without judgment, using active listening and empathetic responses to build trust. 3. Identifying the major problems. Jana reveals that her job loss has triggered financial insecurity, fear of the future, and feelings of worthlessness. The counselor helps Jana prioritize these issues. 4. Dealing with emotions. Jana is encouraged to talk about her feelings of fear and hopelessness. The counselor validates her emotions and introduces techniques to manage her anxiety, such as deep breathing and mindfulness exercises. 5. Exploring alternatives. The counselor and Jana brainstorm potential solutions, such as updating her resume, applying for unemployment benefits, and reaching out to her professional network for job leads. 6. Formulating an action plan. They develop a step-by-step plan that includes daily job search activities, attending networking events, and practicing self-care routines to reduce stress. 7. Follow-up. The counselor schedules a follow-up session to check on Jana's progress, adjust the action plan as needed, and provide ongoing support. In conclusion, crisis counseling involves a systematic approach to help individuals navigate through their crises effectively. By understanding the stages, models, and tools involved, counselors can provide targeted support and empower clients to regain stability and resilience. So these are the types of counseling which are very important, and it will help you guys as counselor to understand and acknowledge the clients, loved ones, friends. Counseling is a vital component of mental health care, providing individuals with the tools and support necessary to navigate life's challenges. Different types of counseling, such as cognitive behavioral therapy, CBT, psychodynamic therapy, humanistic therapy, and others, each offer unique approaches tailored to diverse needs and issues. The variety in counseling types ensures that treatment can be customized to address specific conditions such as anxiety, depression, trauma, relationship issues, and more. For instance, CBT focuses on identifying and changing negative thought patterns, which can be highly effective for those struggling with anxiety or depression. On the other hand, psychodynamic therapy delves into unconscious processes and past experiences, offering deep insights for individuals dealing with long-standing emotional conflicts. Humanistic therapy emphasizes personal growth and self-actualization, supporting clients in finding their true potential and purpose. Additionally, specialized forms of counseling, like marriage and family therapy, address relational dynamics and enhance communication among family members, while career counseling helps individuals identify their professional strengths and navigate career transitions. The availability of various counseling methods allows therapists to adopt an integrative approach, combining techniques from different therapies to best suit the client's needs. This adaptability not only enhances the efficacy of treatment but also respects the unique experiences and preferences of each individual, fostering a more personalized and effective healing process. Overall, the diverse array of counseling types plays a crucial role in ensuring comprehensive mental health care, offering hope and practical solutions to those in need. Models are essential in counseling because they provide a structured framework that guides the therapeutic process, ensuring that interventions are systematic and evidence-based. These models help counselors to understand the complexities of human behavior, emotions, and thoughts, offering a map to navigate the intricacies of a client's experiences and challenges. By adhering to established models, counselors can maintain consistency in their approach, which enhances the reliability and effectiveness of the therapy provided. This structure is particularly crucial in developing treatment plans tailored to individual needs, as models often include various techniques and strategies proven to address specific issues such as anxiety, depression, trauma, or relationship difficulties. Moreover, models in counseling offer a common language and set of concepts that facilitate communication among professionals. This shared understanding is vital for collaboration and supervision, allowing counselors to discuss cases, share insights, and seek advice more efficiently. For novice counselors, models serve as educational tools that provide a clear outline of therapeutic stages, goals, and expected outcomes, thereby reducing the ambiguity and uncertainty that can accompany the counseling process. In addition, models enable counselors to evaluate their practice and measure client progress effectively. They provide benchmarks against which the counselor can assess whether the therapeutic interventions are working and make necessary adjustments. This evaluative aspect is critical in ensuring that the counseling remains dynamic and responsive to the client's evolving needs. Furthermore, adherence to a counseling model enhances the counselor's credibility and professionalism. Clients are often reassured when they know their counselor follows a reputable and established framework, as it suggests competence and a commitment to best practices. This trust is foundational to the therapeutic alliance, which is a key determinant of successful outcomes in counseling. Overall, counseling models are indispensable as they offer a comprehensive guide that aids counselors in delivering consistent, effective, and ethical care. They foster professional development, improve client outcomes, and ensure that counseling practices remain grounded in theory and research. This structured approach is essential in navigating the complex landscape of human psychology, ultimately helping clients to achieve their personal goals and improve their mental health and well-being. Tools are of paramount importance in counseling as they equip counselors with a diverse array of resources to effectively address the varied and complex needs of their clients. These tools encompass a wide range of instruments, including assessment questionnaires, therapeutic worksheets, digital apps, biofeedback devices, and creative aids like art supplies and journals. The utilization of these tools enhances the counselor's ability to gather comprehensive information about the client's mental health status, identify specific issues, and track progress over time. For instance, assessment tools can provide objective data that aids in diagnosing conditions such as anxiety, depression, or PTSD, enabling the counselor to tailor interventions more precisely. Moreover, tools in counseling serve to facilitate communication and expression, especially for clients who may find it challenging to articulate their thoughts and feelings verbally. Techniques such as art therapy, music therapy, and play therapy provide alternative avenues for self-expression, making therapy more accessible and engaging, particularly for children and individuals with communication difficulties. These tools can help uncover underlying issues that might not surface through traditional talk therapy alone. In addition, digital tools and apps have revolutionized the counseling landscape by offering new ways to support clients outside of face-to-face sessions. Apps designed for mental health can provide clients with resources for self-monitoring, coping strategies, and mindfulness practices, thereby extending the therapeutic process beyond the counseling room. These tools empower clients to take an active role in their own mental health management, fostering a sense of autonomy and continuous engagement in their healing journey. For counselors, tools also play a crucial role in enhancing professional efficiency and effectiveness. Electronic health records, EHR, and client management software streamline administrative tasks, such as scheduling, note-taking, and billing, allowing counselors to dedicate more time and focus to direct client care. Furthermore, tools for self-care and professional development, such as supervision apps and training platforms, support counselors in maintaining their own well-being and staying updated with the latest advancements in the field. Biofeedback devices, which measure physiological responses like heart rate and skin conductance, provide real-time data that can be used to teach clients about the connection between their physical and emotional states. This tangible evidence can be particularly impactful in helping clients understand and manage symptoms of stress and anxiety, as they can see the direct impact of relaxation techniques on their bodily responses. Additionally, tools designed for specific therapeutic approaches, such as cognitive behavioral therapy, CBT, workbooks and dialectical behavior therapy, DBT, skills training manuals, offer structured and evidence-based exercises that guide the therapeutic process. These resources help ensure that interventions are consistent and grounded in proven methodologies, enhancing the overall efficacy of treatment. Overall, the integration of various tools into counseling practices enriches the therapeutic experience, making it more adaptable, efficient, and effective. They provide counselors with valuable insights, support client engagement and self-management, streamline administrative processes, and offer alternative methods of expression and intervention. This multifaceted support ultimately contributes to better outcomes for clients and a more robust and responsive counseling practice. Counseling is a professional service aimed at helping individuals manage and overcome personal, social, and psychological challenges. It involves a trained counselor who provides support, guidance, and interventions based on a structured framework to promote mental health and well-being. However, friends and family members can also play a crucial role in supporting their loved ones through informal counseling, although they do not replace the need for professional help. Understanding the nuances of counseling and the ways in which friends and family can contribute is essential for providing effective support. Understanding counseling. Counseling is built on the foundation of trust, confidentiality, and empathy. Professional counselors are trained to use various therapeutic techniques to help clients explore their thoughts, feelings, and behaviors. They aim to foster a safe and non-judgmental environment where clients can openly discuss their issues. The goals of counseling can vary widely, from resolving specific problems like anxiety or depression to improving relationships and coping with life transitions. Key elements of counseling include 1. Active listening. Counselors listen attentively without interrupting, showing empathy and understanding. 2. Reflective listening. They paraphrase and reflect back what the client says to ensure understanding and validation. 3. Goal setting. Together with the client, counselors set achievable goals to work towards during sessions. 4. Intervention strategies. They use evidence-based techniques, such as cognitive behavioral therapy, CBT, dialectical behavior therapy, DBT, and mindfulness. 5. Confidentiality. Maintaining confidentiality is critical, except in cases where there is a risk of harm to the client or others. The role of friends and family in counseling. Friends and family members can provide substantial support to their loved ones by adopting some counseling principles, even without formal training. Here are ways they can help. 1. Creating a safe space. Just like professional counselors, friends and family can offer a safe, non-judgmental environment where the person feels comfortable sharing their thoughts and feelings. This involves being present, listening actively, and showing empathy. 2. Active listening. Pay full attention to the person speaking, avoiding interruptions. Show that you are engaged through nodding, maintaining eye contact, and using verbal affirmations like, "I see," or, "That sounds tough." 3. Empathy and validation. Acknowledge their feelings without judgment. Phrases like, "I can see why you feel that way," or, "It's okay to feel upset," can be very validating. 4. Encouraging professional help. Recognize the limits of what you can offer and encourage them to seek professional counseling if needed. Sometimes, friends and family can help by finding resources or even accompanying them to appointments. 5. Practical support. Help them with daily tasks that might feel overwhelming, such as cooking, cleaning, or managing appointments, to reduce their stress and allow them to focus on their mental health. 6. Being patient and consistent. Mental health struggles can be long-term and non-linear. Patience and consistent support are crucial, even on days when progress seems slow or non-existent. Conclusion. While professional counseling is irreplaceable for addressing complex mental health issues, friends and family can significantly support their loved ones through informal counseling practices. By creating a safe and empathetic environment, actively listening, validating feelings, and encouraging professional help, they can provide much-needed support. Real-life examples demonstrate the profound impact that such support can have, highlighting the importance of patience, consistency, and practical assistance. Ultimately, the collaborative effort between professional counselors and supportive friends and family members can lead to more holistic and effective mental health care. Counseling can be tough in some parts, but with proper help, understanding and guidance, you can achieve positive results from it and help your loved ones and friends.
Thank you for your time, and I hope you liked the video. Please share, subscribe, and like the video. It will give me motivation to create more contents like this and to help you help your loved ones. Stay tuned for more.